Hi there, it's Kathy Cates and Melissa Hines from the Institute for Pelvic Health.
And you're watching Demystifying the Pelvic Floor, weekly videos providing real and simplified pelvic floor education for your real clinical situations. We've got you covered.
And today we're going to talk about Kathy's experience as an NP and patient and what inspired her to join with me to create the Institute for Pelvic
How fun.
Health. So, Kathy, I know the story, but tell everyone how you got involved in the pelvic floor on your
Totally.
NP journey.
Totally. So I ran a women's health program for many, many years. In the first 4 years, I did tons of pelvic exams, IUD insertions, endo biopsies, colposcopies, you name it. And I never once thought about the pelvic floor. Bad, very bad. Um, and then after I finished my treatment for breast cancer, I was positive for one of the BRCA genes that's correlated with a slightly increased risk of ovarian cancer. So I had a bilateral oophorectomy, and then I was in surgical menopause. And then I had significant dyspareunia, and I didn't know what to do. So I went to my own nurse practitioner at the gyne onc office, and she said, "You need pelvic floor therapy." And I was like, "What? What is that?" Like, and so she handed me a list and she said, "Here you go, but pick these people." Um, so I said, "Okay." So I called those people. They were amazing. And through my treatment, I said, "How did you guys learn how to do this?" And they said, "Well, you could learn how to do it because you're licensed to work internally." So I said, "Okay." And so I was really lucky in that there was a grant opportunity for primary care provider retention within the Massachusetts League of Community Health Centers. So I applied and they called my grant Bringing Awareness of the Pelvic Floor into Primary Care. I was awarded the grant and it gave me protected time to go get the training to learn about how to do pelvic floor therapy. And it also gave me the time to be able to have 30-minute slots during my clinic day rather than 15-minute slots. Um, and so that's how it all started. So,
Yeah, so I mean, it's very cool. And I think with my journey with PT school, like we never learned about
yeah,
the pelvic floor in PT school. I mean, in gross anatomy, which is like the main musculoskeletal class that we take, we didn't dissect the pelvic floor or talk
oh, you
about it at
didn't?
all.
Huh.
So when I started, I mentored with a woman that specialized in pelvic floor therapy, and that's how I was like, oh wow, this exists. This is really cool. And so I
Oh,
took continuing education through the Herman and Wallace Institute, and I remember being like, oh my gosh, like there's muscles that like we can't see or like don't really know like what they're really
yeah,
doing. Like how do I even palpate those? How do I treat that? So it was really complex for me being a pelvic floor therapist as well.
totally. And I think that's what's so exciting about in working with you and learning about your story, seeing like all the potential to really work together, right? Because, and I remember when I did the continuing education, I didn't go through Herman and Wallace. I went through John Barnes. And once we got to the Women's Health Week, like everybody wanted to be my partner because I knew how to do bimanual exams, right?
Mhm.
And so, but yet I was much more skittish about the like hands-on technique. And so I
Yeah,
think working with you, learning from you, creating this institute is just such a
yeah,
amazing opportunity to not
definitely.
like stay in our lane so much, but really create this
Mhm.
interdisciplinary community where I think we really help people
Yeah,
a lot more.
yeah. I mean, because as an NP, you're doing exams, internal exams all day long.
Totally. But
And
never realizing that there were muscles or like that those muscles had motor control.
yeah, and as a PT, like when I remember first doing my internal exam being like, oh boy. What did I
Right,
sign up
right.
for? So
Oh,
yeah, and I had really confident hands-on skills. So I think the two of us together, I've helped with your hands-on skills and you've helped me feel confident with my
mhm,
internal palpation skills. So it's a cool
totally.
combo.
Yeah. And so it's so exciting about our course because we're putting it all together to
Mhm.
really help NPs, midwives that are already comfortable with a bimanual exam to just like up level the whole thing.
Thing.
And that's
Yeah,
what's so cool.
and really help patients. So our course is launching this September, so get on our wait list on our website at instituteforpelvichealth.com, and email us if you have any questions. And we hope that you sign up and join us in this journey.
Yeah. Thanks so much for watching and spreading the word. We're going to revolutionize pelvic health and we're going to do it together. We'll see you soon.